Good morning. A warm welcome to Drishti 2022 and the hospitality of Calicut. This session will be dealing with practice management, and it will be mainly a panel discussion. You can put forth your questions also, and we have got a lot of very pertinent subjects that we are going to deal with here, and we got an excellent panelist. Our co-chairperson, I am Dr. Sasikumar. I will be chairing this session, and I invite Dr. R.D. Ravindran, our co-chairperson, to the panel, and Dr. Chitra Ramamurthy. He's coming. Okay, sir. Okay, Dr. Ramamurthy. Yeah. Dr. Shentil will be moderating the session. I invite Dr. Ramamurthy to the stage. Dr. Radhakrishnan. We will be dealing with A to Z of ophthalmic practice, starting from charitable service, how to become a successful entrepreneur, monetizing your practice, how to improve the saleable value of our practice, what does an employee doctor want, and points on ethical practice also. So I invite Dr. Senthil to take over the proceedings.
Thank you, Kerala Ophthalmic Society, for the opportunity to talk about practice management. I think generally in most of the conferences, this is an ignored topic. Happy that Kerala Ophthalmic Society has taken it on the first day in the early morning sessions. And I think most of the panelists here don't need a lot of introduction. So I think we have almost 55 minutes, and Dr. Srini asked me to focus on various aspects, right from somebody working in a hospital to somebody thinking of an exit of the practice. So we have a wide range of practitioners here, right from people who have just started practice to people running charitable hospitals, and people like Dr. Ramamurthy who are running a corporate chain also. So can you project the questions? No, it's okay. It's okay. So we will start off with the question on employees. I think many of us are employees here. Many start as employees, then go to run practices. So compared to a corporate setup, like if somebody joins a company, somebody even starting on the shop floor, he has an opportunity to become the CEO of an organization. So even in, say, if you are in Pepsi, you start at a very most level, and he has the opportunity to even become the CEO of PepsiCo. On the other hand, somebody joining a hospital, let it be a charitable hospital or even a corporate hospital, he joins as a consultant. And what are the growth possibilities which he has? Like how can he expect to grow? Does he not get saturated after a few years? Is there like a consultant, how does he see growing himself in that organization? We can start off with Dr. Ramamurthy, how somebody grows in a corporate, and then Dr. R.D. sir can talk about how somebody grows in a charitable organization.
I think it's a very important question, Dr. Sendil. I mean, and people are not just looking at monetary growth, but also growth as far as the position in the organization is concerned. And it applies not just to medical consultants or ophthalmic consultants, but every employee who is with us, whether it's an optometrist or a receptionist or somebody in the administrative cadre. And we essentially ensure by giving them a sense of ownership in the sense that, we have multiple centers, but we have a ground plan, we have a broad framework, but each center functions on its own, and basically depending on the performance of that particular center, the person is incentivized. Once they have gained adequate knowledge, they know our practices, they're shifted on to another center where they take a leadership role. And we don't intrude on a day-to-day functioning of the hospital. For example, I have a branch in Malappuram, but after 2 years since its inauguration, today will be the first day I'll be visiting the place, simply because I'm close by. But otherwise, it's essentially that center which is responsible for the growth, and each and every person contributes. They are taken on a fixed salary. Over a period of 3 months or so, we started an incentive scheme, and which is not really competitive, but based upon the entire center's performance. And over time, as I said, it's also a change in the designation, change in the responsibilities. As far as they feel they have a sense of belonging, they have a sense of empowerment, they feel that they are not just working for you, but they can individually grow and grow along with the organization. I feel it works well, and this is the model we, by and large, tend to inculcate, not just in the ophthalmic consultants, but across the board for all our employees.
Sir, can I've been an employee throughout. I probably will stay an employee. So, see, see why I wanted this question to be addressed is, see, as an employee, I always have a feeling that my management might think of me as a competitor in the future, a potential competitor. And I think I'll be right when I say that the management might, we might say otherwise, but management might also think of an employee as a potential competitor in the future. So how do we address that? So how do you make sure, because see, you don't want somebody employed under you to start a hospital right in front of you. There are hospitals which don't allow their consultants to give their personal cards. So it's a delicate balance, but this is something that has been, every day it is there in my mind, because I know that I'm a potential competitor. See, there is another aspect to what you said. See, a feeling of ownership. See, after one point of time, it might be a feeling of helplessness. See, I can't move out. We feel that it is a feeling of ownership. See, I might be treading onto controversial these things. So how do we balance that? See, being a corporate, see, in a charitable hospital model, it's there are reasons why. See, there is a reason why I am in Comtrust Charitable Trust. Still, I have that feeling. But if I was working with you, probably I would be really be worried about this. So how do you?
We should be worried if you are working with me specifically.
Sir,
No. I'm just giving an example of a corporate. Sorry, sir. No, I'm talking.
My next question is something related to what Srini asked. Like, what if Srini becomes entrepreneurial?
So what?
Is there an opportunity to associate with a corporate?
No. There is enough fish in the water for everyone. This applies not just to medical practice, even a pawn shop owner or anybody. So if you want to grow, you have to delegate, you have to employ people. And once they learn the art, some of them may go ahead and open up their own practices. Let them flourish. I mean, having said that, there is also a barrier to entry today. My consultants are all used to a certain levels of working, the instrumentation that is provided to them, the kind of access to femtosecond lasers, all kinds of, depending on whatever practice they are doing. And today the cost of his infrastructure, people, it's all become so much more that there is, not everyone wants to venture into it. And if they see a growth path, their life is well taken care of, their children's education, their free time, everything is taken care of. Not everyone wants to go out and get into this rat race of private practice. And if some of them have the fire in the ability to go ahead and do it, then let's let them do it. If Arvind Eye Hospital was worried about that, almost everybody who is practicing in Tamil Nadu, Kerala, parts of Karnataka have spent some time or the other in one of their institutions. There is no way they could have grown.
It is also a message to all the people who are having good employees with them at a senior level to keep them feel challenged and very involved and keep increasing that. It is not always on a monetary thing. Incentivizing them and keeping them very comfortable where all their needs are met is fine, but challenging them and giving them responsibilities on administrative levels and recognizing them in every podiums and everywhere, then that person starts thinking that he is also growing along. Only when you start stagnating in an organization do you feel that should you go out and insecurities and all come. So I think we need to keep our whole family very cohesive and strong and growing along with us. Maybe I'm saying the same things which he's saying, but I felt that on an emotional level also we should reach out to all of these people so that each of these employees feel very secure throughout their life that they did the right thing by being with us.
No, actually, the problem is that in a hospital, somebody joins as a consultant, and there are not multiple levels of upgradation. Like in a corporate, there is a junior manager, senior manager, CEO. So, hospital, I think after some time, employees might get that feeling that I joined as a consultant, still I am a consultant. What is done in Arvind Eye Hospital to take away this feeling of stagnation?
I mean, the point you are making is true. One is, for a doctor joining a hospital, they can be a consultant. At the most, they can become a head of the department, or they can become the chief medical officer. So that growth path is very limited. So it all also depends upon the vacancies available. Whether it's a HOD position is there, then you can become a HOD. Otherwise, you remain as a senior consultant. Becoming a CMO is even more difficult, in a given setup when you have about 60, 70 doctors. But I think the real challenge for a leader is to how do we engage. We know that we cannot give them a different titles, but in spite of that, how do we challenge them so that we can keep their aspirations also alive. I think the one way we does it in Aravind is to challenge them to become a competent surgeon, an effective surgeon, where the outcomes are good, complications are less. Then the challenge is how do we make them an efficient or productive surgeon? Make somebody do 100 surgeries in a day with minimal complications or good outcomes. I think once they cross that barrier, how do we make them also academically involved? Today, because of that constant push, we were also able to increase the number of publications to the level now we have about 350 publications, in addition to what all that do. Then we also provide opportunities for them to get involved in epidemiological research and basic science research. I think that's all one. And there are also a group of people who get involved in now how do we ensure quality in the organization. There are also different positions where we engage them. And recently we have taken up a kind of recent effort is to see how do we create more clinician scientists. So we are looking at least 20 of our ophthalmologists becoming earn a PhD degree. So we have got into agreement with some of the universities locally and also internationally. I think probably if we can take them away our idea from giving them a title, that's also important. But if we can constantly challenge them so that they really move forward, academically, as a teacher, and also as a scientist, if they are able to move forward. And there are also, we don't expect the same from everybody. There are also people who really bring together the staff. They may not be very effective, but that person is able to hold on, to many people. Many people may go to that person to share their problem. He's like a undesignated counselor in the department in the hospital. He is able to take care of them. I think we need to recognize the strength of each people and support the work is what I feel. Because a designation probably may not be very important in a hospital setting like that.
So I think the key is the organization has to grow for you to allow people to grow within. So that becomes very critical. And the second part is you gave an example of PepsiCo, but we forget that India is also a land of the Dabur or the TVS Motors, which are family-run businesses. The key is they are professionally run. So I think as leaders who are running institutions, it's important to understand that we don't know it all. And we should be willing to let go of certain areas to more competent people and allow them to come up like what Sir was mentioning. If they're better than you, so be it. They run that much better than you. That I think is the most critical element. So today 50% of our CMOs are people who've done their DNB with us and grown with the institution. Because the key challenge in hiring somebody laterally is your culture. So somebody who's been within it is much easier for you to replicate the culture and move it forward. Letting go by the leader, I think, is a key reason why people don't grow. And like Sir mentioned, I think as doctors, we need to see the world outside. We are like a frog in the well. We assume that our subspecialty is the only place we can shine. We don't understand that there are much other areas. Today, research has become an area. Academics has become a critical area. Otherwise, the notion always was if you're not a good surgeon, you take up research or academics. So we also need to see the world outside. I think today as doctors, we are capable of even consulting for corporate companies. We can be on their board and tell them, but we see everything as black and white. That has to change.
I think nowadays nobody can start a hospital individually because of the cost, the infrastructure you need. So either you have to join an institute or a corporate management. A third possibility is group practice. 4 or 5 specialists joining together and starting a hospital. So all the specialties covered, the amount you spend is less. And the group management is there. I think the pioneer in that in Kerala is KGR Nair. He started in Chaitanya Hospital as a group practice. In many other institutes also are coming up like that. So that's one way of satisfying yourself both professionally, economically, and independence. Because you are joint responsibilities there. Corporate management, I don't think it's a bad thing, but it depends on the management. If you have good management, you'll be happy. You will have all the facilities, all the freedom to do surgeries or research. So it depends on a lot of things. So if you are not on the right side of the management, you will be out in a very sudden way.
Sir, let's understand our audience. So how many of you have a hospital? How many are just employees? So majority have hospitals. I just wanted to see how the discussion should be going, but because I got Rakhi in because she's just started her, and my aim was people like her who can get something out of it to plan their career and all. So we have sort of talked from the employee's point of view. Let's hear from what.
Hi, good morning, everyone. So as a beginner, and I'm an alumni from LVP. So when I shifted to Kerala, I had 2 priorities. Whenever I was searching for new hospitals to join, first priority that I should get hands-on. It's not like I should get 10 or 15 cases, at least 2 or 3 cases in a week, so that I should not forget my cataract skills. And my second priority was I got this kick of research and writing papers, everything from LVP, so I was very fond of it. So I was looking for an institute which will actually allow me to go for such academic events. So when I was searching, the problem which I faced was few of the institutes have working hours which are like 9 to 6 o'clock or 6:30 and all. which will be very difficult to balance because after you go home, you have your own family responsibilities also. Even I have a kid. So that will be very difficult. And most of the leaves, like their normal leaves which they give, most of the institutes, like not the institutes, I'm telling about the smaller hospitals, are not allowing academic leaves or conference leaves. So when you're going for such things, like it is usually getting cut from the casual leaves only, which are very less. So those are the issues which I was facing here. So few of the institutes are not actually appreciating when you're going into the line of research and things. So I was also looking for some institute which will help me also to grow. It was not the monetary benefits which I was looking for as an initial beginner. Mostly somewhere, like Ramamurthy sir said, like we should go, I also felt like I should grow into an institute where I can learn from the seniors as well as I can individually grow as a surgeon as well as a researcher. So these are the priorities which I think the newer generation are also keeping first.
Like the point she's making, Sandil, I think we have to understand the aspiration of the employee. I think we have to respond to that.
Yeah,
But I think for any doctor, the real satisfaction comes from clinical work. The rest all probably kind of a value add. That's what I will also say. Yeah.
So actually, when I was an employee, my aspiration was different because I wanted to have a mentor or yeah. So when, as doctor said, her aspirations were different, but when I was an employee, my aspiration was different. I was actually looking to partner with a senior doctor to start my practice, which unfortunately didn't happen. I think maybe, I don't know whether I'm getting into a dangerous line here, whether a corporate or a charitable hospital will also help a junior or a consultant who has worked with him to set up his own practice, maybe in a partnership model, or I think there's lots of guidance provided definitely by the seniors, but in terms, because after some time, whatever designation, whatever monetary benefit you get, still there are a few of us who want to be our own bosses. We want to do our own work. Maybe via media would be like a senior hospital where somebody working as a consultant also helps him to set up the practice in a partnership model. Will you, I don't know if it has been done before. Yeah.
So we have not done it, but if somebody has got we in Aravind, that we work with nearly with 350 eye hospitals. So wherein we share whatever is the strengths, all our strengths, whatever our protocol, process, our software application, everything we share. And there are also many instances we send our team to even help them recruit staff, train them, put them back. The charitable, if the motive is to be a charitable organization, then we really work with that. With those, we have not really worked with private organization except for few. We have worked with, supported few private organizations, but not in the way you are kind of looking at it. So,
Can I have a comment, sir?
Yeah.
So, sorry for interruption. So, if everybody's seen the picture Puspa the Rise, I think you must have seen the hero asking for the percentage, not the total emoluments. So he said, take 10,000 rupees. He said, I don't want 10,000 rupees from you. I want 0.1% of your profits. So I have a feeling that I am a partner of this institution. I am not an employee of this institution. So everybody, a newcomer, when it comes to an institution, he wants to be a partner. As Dr. Senthil said already, that he wants to be a partner of the institution instead of becoming an employee. So I think that concept is really good. I think it helps in the long run of the newcomers. Thank you.
I think it's very it is difficult, for us sitting here, corporate hospital, charitable institutions, where there are many employees as doctors and others, to set an example or a structure, you say, you do this, you'll be successful. I think each of us, as doctor said, you have to set your own priorities as to say, what exactly want you to do. You want to grow as a clinician. Forget about the designations of consultant, senior consultant, chief, the surgeon and all that. But clinically, academically, or you want to go into a group where you have a lot of patient turnover, like in Aravind, a big hospital, with charitable institution, where you will be playing your part, you will get your importance, you will be respected, you will be grow along with the institution. Or in another corporate hospitals where you have. The only thing is that as far as I was heading a corporate hospital, as a general hospital, not an ophthalmology hospital, about 10 years. I've been in mostly in the field of charitable institutions, heading them. But the thing is, in corporate hospitals, many of our decisions from the management comes from MBAs rather than the doctor's level, probably. That might be a little difficult to deal with at certain points of time, whether you will be able to express yourself, whether you will be listened to, whether you have really put forward your efforts, whether they will appreciate you and things like that, etc., etc. So when you choose your profession, make sure that there are opportunities, there are difficulties anywhere and everywhere you go. Thank you.
I think
So till now we were discussing about what the management will provide to the employee. Now my question is that what actually the management looks from the employee. What is your what is your ideal employee to be? Like how should be a doctor in? It's an ideal, because till now we were asking like we need this thing, we need that thing and all. Now what is the management side? What is you look from a, could you say that this employee is an optimal, it's good for the institution? What all things you are looking at?
since I have the mic, I think as far as the expectations of the management and the expectations of the employees match, that's when the relationship works out well. Basically, what I want from my employees: integrity, honesty, dedication to the institution, and a urge to grow. Unless he or she wants personal growth, they want to progress in life, they are not going to be a good employee. They are not going to contribute significantly. I don't mistake a person who wants an increment in their salary on a yearly basis, on every couple of years. Is their moral right. And similarly, if they want to attend conferences, involve in meetings, present papers, and they just don't want to see the people at the top going up, but they also want to get involved, those are the people who are really going to contribute. And as far as what you were talking about, just like you can't club all charitable institutions into one basket, when you talk about corporate, it's not that all of them have the similar ethos or similar type of practices. I think there's a wide variation. I'm not even sure how I got labeled as a corporate. Whether I should take it as a compliment or something different. But anyway, what I'm saying is we do have doctors managing, we do have CFOs, we do have CEOs who give relevant inputs. And Sendil put it, it's also important that we get professional advice on these matters. But having said that, I think keeping in view, my basic ethos is that the growth of the institution and the growth of the individual has to be linked to each other. And as was being said, after a certain period of time, there are people who say the fixed salary, we don't give incentives, etc. Let's understand this. Money is important for everyone, for the institution, for the individual. And we do incentivize right from 3 months after they join us, depending upon the department they are dealing with, or depending upon the overall growth of the center as such. There is a certain percentage which goes to the employees depending upon their seniority. And once they feel that if that particular center or that particular vitreoretina department is going to do well, they are also going to get benefited from that, they automatically tend to contribute. If they think whether I do 2 surgeries or 10 surgeries, at the end of the month I am going to get the same salary, I think that is slightly demotivating. Not everyone might agree with that, but that's the policy we follow.
No, sir.
I think employees, we have discussed a lot about employees. We have only 24 minutes. So one thing to address this question, I have been working with a lot of these corporate hospitals. Most managements are looking at doctors with good communication skills. I think that is the biggest patient skill. is lacking in most of the doctors. Like you can be a good surgeon, but what is more important in convincing a patient and getting him for surgery is the communication skill. I think many hospitals value people with better communication skills more than even people who have good surgical skills, because surgical skill can also be acquired. Communication is what is lacking in a lot of I think upcoming employee doctors should definitely focus more on developing good patient skills. I think because we have a lot of private practitioners here, once we start our clinical practice, we try to wear multiple hats. We want to be an entrepreneur, we have to do HR management, we want to do financial management, everything has to be done along with the clinical work. How do you, maybe we can start with Dr. Ammuthi sir, like how do you manage both the work, like administrative and clinical? Because when I tried to do both, I was not able to do. So I slowly moved away from clinical work. So how do you still maintain this balance between administrative and clinical work, or do you work, maybe RDR sir can also contribute, do you also, or do you work more time, like for clinical you spend 8 hours and administrative 4 hours, something like that?
No, no. So I've held various positions. I've been worked under the chief medical officers with Dr. V and Dr. Nam earlier, and then also independently as a chief medical officer from the beginning. So, I mean, as long as I was a chief medical officer for over 25 years, I can say about 85-90% of my time is for the clinical work. And you know, if you have a good admin team, and if they are able to structure it, and then you'll have enough time. I think that's how anybody who's running, you know, have to balance both the administrative work and clinical work equally. You know, if they have the responsibility for both, then that person should probably give 75-80% of his time for the clinical work. And admin work, we should be able to structure it. We have a good policies, and then take time to decide on those policies and stick to that. That's what probably should be the way to go. You know, because you know, without taking good care of the patients, just focusing on administrative work alone is not going to work. But you know, if you are able to find somebody who can take over the clinical work, probably then you can move towards the administration work, but it must have a purpose as to some way, you know, that you should be able to really grow that clinical part of it in a much better way. So
I see the common problem in smaller hospitals is that the owner doctor tries to do everything. He doesn't want to appoint any administrative staff, which on the other hand is different in a larger organization. I think at least 1 or 2 administrative people should be appointed. And most of the small hospitals, it is like you have your wife or father who is a non-ophthalmologist as the administrative person, who might not be trained for that particular job, which sometimes also backfires when you have a close relative. Maybe they are very honest, but whether they are skilled to do that job. So smaller hospitals, I feel, also should have budgeting for at least 1 or 2 managerial staff to take care of the management work. At least, even there are not good accountants in many hospitals, though they might be doing a large turnover, but still the doctor wants to do everything. I think our time is also limited. Sir.
I think the clinical work I do because of my passion, because that's what I enjoy, that's what makes me happy. Administration I do because I have to administer, I have no choice. So most often we are torn between these two. I have about 70 odd consultants. Whatever cataract and refractive surgery I'm doing, I'm sure many of them can do it. I mean, it's not that I have to essentially, I see less than 1 or 2% of the total number of patients coming into our hospital. But having said that, striking the right balance is important. And as we all experience, our number of hours we put in keeps on increasing. It's 10 to 12 hours in a day that we are working. Maybe it's divided equally between administration and, but with the ability to give up, like some of our seniors have done in other places, and moving on to administration, but just by doing routine surgeries, by seeing so many patients, you're not really, the organization is not going to grow. Employing the right people, as you said, and getting more and more involved in administration and taking on a leadership role to give a direction and extracting the right kind of work from the people under you and incentivizing for the same would be the solution for the growth of an organization. But most of like us, I think Dr. Hardy are also in the same boat. We continue to operate not because there are not others who can't do as good a job as we have, but it's just because we like doing it.
Sendil, see, let's, I mean, we are almost halfway through. There are two other important factors which I wanted you to discuss. See, one is the monetizing of your practice. How do iFoundation or Center for Sight or whoever value a practice? See, it is based on the turnover or EBITDA or whatever. And see, I mean, if you don't want to reveal what because different groups have different calculations. So what is a rough figure like? If I have a hospital, if Anish has a hospital or Rajesh has a hospital, when you take over, see what is the, because we would like to know, see what is the valuation, and see there are few people like me. See, I don't have my own hospital but I know how much I am generating. But if there is a person like that and you want to make that person, I'm never going to come out, that is a different aspect. So if you want to take over that fellow's practice, though he doesn't have a balance sheet to show, or a hospital which has a balance sheet to show, when you take over, how do you value that? See, that is one I want you to answer. The other one I want Dr. Senthil to answer, how to improve the monetizing of your practice. What are the steps that we have to do to improve the monetization? Dr. Senthil.
So can I answer that somebody is an employee in a hospital, and how do you value that person as an employee? Like whether you want to take that person put in your practice. I think it's a very tricky question, basically because see, ophthalmology works in a very different way compared to cardiothoracic or orthopedics, where the practitioner, let's say some cardiothoracic surgeon works in Apollo Hospital, or some orthopedic surgeon works in Apollo Hospital. Though the brand is larger, over the time the surgeon is also valued more. Meaning somebody moves from, say, ABC hospital into CDE as a cardiothoracic, a lot of the patient pool also follows him particularly. So there is a valuation. So somebody from ABC hospital can go to CDE and command a good valuation as a team. So I know a lot of cardiac teams which move on from 2-3 corporate hospitals. They take upfront money and they also have a particular revenue strategy which they get every month, because under a commitment of generating, everything is financial here. You have to generate a particular amount of money. So a cardiothoracic team moving from ABC hospital, cardiac surgeon, anesthetist, everybody, 10-20 people, they even command a value of 10-20 crores even as an employee moving into another team, and every month maybe they say minimum our team has to be paid 1 crore rupees, and they guarantee a revenue generation of say 10 crore for that hospital minimum. On the other hand, ophthalmology is slightly tricky because the brand of the hospital is also more. When somebody moves out from ABC Eye Hospital to CDE Eye Hospital, he may not be, maybe Dr. Ramati sir can correct me, so he cannot pull in all the revenues just because the person is moving. It's different in ophthalmology. I have not seen too many of ophthalmologists who command that kind of a patient pull over to another organization when they join. So somebody moving from hospital A to B can only command a better salary but not revenue. That is what I have seen.
That is because you're not seen that happen.
No, I have seen that a few of the doctors moved. I've seen some doctors generating better revenues, particularly when they are a little unethical. Sorry to say that, say they kind of take the database from, it happened in a large corporate hospital only. So they take the database, go away with the database, they say, I'm now here, they call, say 20,000 patients they have seen. Or somebody consciously also tries to has this idea of moving from one hospital to other or starting his private practice. Maybe the last 3-4 years of his practice, he develops a more personal rapport with the patients. He says, I am the surgeon, and he calls the patients, and a lot of things, all these things have happened. If you are ethically moving from A to B, I don't think you can command the total revenue shifting from this hospital to other hospital.
You need to, when you move from A to B, you need to worry about taking that patients from there to here to get your position. I think when as a employer, you would want capable people to join and discuss with them, and you have the ability to understand what he can bring to you and what you can do for him, and you can take a call. You don't have to bring patients from the other hospital. There are so many patients going everywhere. So the employee need not feel insecure on that. He need not be monetized. Individuals need not be monetized. They are judged by their surgical capacity, their communication skill, the kind of stability and the kind of honesty and integrity which they are showing. They may be moving from one place because they've started stagnating there. That doesn't make them bad. But if that inner quality of them, that employer who's good, he will be able to judge that, and he will be able to give them the chance and opportunity to grow. So I don't think you start a practice thinking what is your value. What is the value you have generated in the society is your value, I think. If you think like that, we'll be a happier person.
Srini, I think to put it very bluntly, rule of thumb is you should be generating 3 or 4 times the revenue that you're being paid for. So if you think your value is that high, are you generating that kind of a return? Because you will have to pay for the other hidden costs that the institution is taking on your behalf.
4 times should be the profit that a hospital or the turnover?
The turnover, typically. See, ophthalmology, our contribution is about 65 to 70%. So that way it kind of hedges around. So if 3 to 4 times is the revenue that you're being paid is being done, I think it's a fair deal.
But there is
like I said, it's a very, very basic kind of a thing. But the presumption again is, I think today we are too caught up with this valuation thing because of the startup industry. The startup industry looks at valuation from a potential revenue standpoint. In our hospital environment, we are not technology driven like an edtech or a fintech company, where you can't say that, okay, 1.3 billion population, therefore sitting here in Calicut, I will handle so much of population and 45% will come on an Excel sheet, all that will work. But finally, cash is king. Whether, like sir said, whether you're corporate, charitable, that I think is largely from an accounting and a taxation standpoint. Every institution, whether it is a single practitioner or a multi-speciality or a large practice, is run in the same financial fundamentals. So from that standpoint, when you're looking at valuation, your asset is a tangible asset. Beyond that, your patient flow, to some extent, you can extrapolate it for a year, year and a half. Because again, ophthalmology is very geographically constrained. If you're doing only cataracts, after you've drained out the cataracts in the geography of 15 to 20 kilometers, where are you going to go? So if you're in a very small location, again, you can't extrapolate your revenue today for the next 15, 20 years. So I think somewhere there, people have to be a little prudent about how they look at themselves.
This is a little lopsided or paradoxical in ophthalmology. I mean, leave alone cardiothoracic surgery, etc. Because you may have an excellent UVR person, a very good neuro-ophthalmologist, a good pediatric ophthalmologist. But all of us know the mullah essentially comes in from cataract and refractive surgery. You are capable of doing 80 cataracts a day, but that doesn't mean a very good neuro-ophthalmologist is maybe really not generating much income. So as institutional builders and as taking an overall view, revenue is important, but that I'm sure all of us agree that that's not the only thing we go by as far as the importance of a particular individual to the center is concerned. Previously, vitreoretinal surgery, even 10 years back, was considered as a minor contributor. Now things have changed. Their generation capability is almost as good as what a good cataract surgeon. But having said that, I think you have to recognize the value not just by the revenue generated, but also by the quality that bring in, the kind of recognition they bring into the institution per se, which makes people to come into your hospital because of what they are able to provide. And as far as somebody who comes in with information, a database or something, comes to me, that usually doesn't happen at the doctor's level, but at the other employees level, I'll be extremely wary of taking such a person, simply because a person who brings that data to me is likely to take my data to some other person. And I don't think beyond that certain point, it doesn't matter to me. How is it, does it matter that Narasimhan or Narayan Murthy got operated in this hospital by this doctor? He's already got operated. What am I going to do with that? So really, that doesn't add. And regarding your primary question regarding valuation of a particular practice, we have not done it too often. We just take over a very stable practice in Bangalore because I knew them. I was very comfortable with them. But otherwise, the general thumb rule is we go more by the EBITDA. You know, it's not the infrastructure, the built-up costs, other things are not. It's more the revenue generation that is there. That's one aspect. More importantly, how well this center is being done and what's the EBITDA that's being generated. The usual valuation nowadays, it can vary depending upon the location, depending upon the size of the organization and so many other factors. Usual valuation now is about 8 to 9 times is what we get, depending on the annual EBITDA. But this is usually tied down because it's a very specific question you asked. Tied down to a performance going forward. Like that is, you don't pay 100% upfront, but say 50% or 51%, so that the company which takes over acquires control of the particular center. But then the rest of the money comes in over a period of time, depending upon the maintenance of the EBITDA at certain level. And it's also for money is one factor, but the more important factor is the comfort level and the relationship that the person taking over, the person giving up the organization have, so that the relationship lasts over a period of time. And only when that works out well, I find that these takeovers really benefit both the parties.
I think before that, how do we arrive at the valuation? It's also important that many of the private practitioners, they don't think about exit option at all, because we had one senior doctor who was almost 70 years old, didn't want to join, add another junior doctor into his practice, and suddenly one day he died. So whatever he has built for 30, 40 years doesn't have any value, because smaller practice, most of the corporates or bigger organizations also look at a practice which will continue, because just taking the practice without the doctor doesn't make value. So somebody who is 55, 60 or even lower should all, if there is no children who is an ophthalmologist, should look at an option of exit, should at least add another junior doctor. If you don't want to sell to a corporate, at least add another junior doctor to your practice so that you can hand it over to him after some time.
Yeah, this is a problem with key man practice. Let's we have only maybe 10 minutes. Let's move on to what I wanted you to address. See, how do you, like, what are the steps that if I have a hospital, I am planning to sell it to, let's talk on business. I'm planning to sell it to Center for Sight. Okay, after 5 years. So what all steps should I take to make sure that they do find real value in me? EBITDA is something, but there are other intangible aspects.
The first thing, I think I started with that point. So first thing is you have to think of exit. Most of our colleagues don't even think of exit because they think we will be practicing for a long duration. So whenever you are 55, even younger, I see a lot of I advise around 8 or 10 eye hospitals on this particular aspect. So they are being groomed to exit also. I have a few doctors who are only 43 years old, but they have at least a 10 crore turnover now. So so they have an option to sell their practice at 40 to 50 crore value at the age of 43. So whether they have to grow it. So basically one thing is this mind, the thought that, okay, I should think of an exit option. That is the most important thing. And particularly, maybe Dr. Ramamurthy sir can correct, majority of the corporates also look at practices which have a sizable turnover, maybe at least 30 to 50 lakhs a month. So I think in India there are not too many practices which has got 30, maybe 500 to 1000 practices which has got a turnover of 30 to 50 lakhs a month. So you have, if you are thinking of an exit to a corporate, basically you should also try to build your revenues to that level. Or if your revenues are not that high, at least add another junior doctor or take in partners, colleagues who can share your practice along with you. And then you, then generally maybe after some time it can still grow to that 30 or 50 lakhs revenue per month. Why the corporate looks at that kind of revenue is because they are looking at adding value to their balance sheet. So at least 5-6 crore is what will make sense for a corporate per year, because the work involved in an acquisition is also not simple. So they may not simply acquire a practice which is generating 1 crore in a year. So you have to look at generating a decent revenue. Another common problem is most of the time our practice is not regulated and structured. Most of our money is unaccounted. When you say, somebody will say I have a turnover of 4 crores, but maybe 1 crore is what accounted. So you have to, if you're thinking of that way, you have to make everything white, structure your practice that way, have your, many of the practices, even from the company level, it's only a proprietorship concern. Maybe a corporate may not want to acquire a proprietorship. You have to at least convert it into a LLP or a private limited company, because acquiring a private limited is easier. And all the regulatory things, the labor laws, the GST and all these things, I think you have to put all these makeover to the practice if you are wanting somebody to acquire it. I think that is what you should. So the first thing is the thought that you want to be acquired or you want to exit, you are thinking of exit is the first thing which you have to do. And then if you are thinking of an exit, whether you want to add another junior doctor or thinking of an exit to a larger corporate hospital, I think it's a good time for somebody to really exit, because see, if you are having a turnover of 30-50 lakhs a month, you can definitely get 40 to 50 crores valuation. So 50 crore invested in a mutual fund for the next 20 years on a 50% growth rate definitely will give you 150 to 200 crores. So you don't have to work really very hard. If you are having, if somebody has a decent practice and has a offer for a good exit, I think you should definitely exit. So you have to structure and streamline your practice so that it also makes attractive for the corporate to acquire, corporate or anybody to acquire. You can even, there are now even individual ophthalmologists who have good practices who want to acquire other practices, who want to partner with other practices. So, so that is the thing. And only thing is, a medical practice is not like, as Dr. Kaushik said, it's not like a software. A software company can have a turnover of only 10 crores but still sell for a huge money. But medical practice may not be having that kind of a valuation.
I think now we are all thinking of financial implications and valuing as a commodity. But I think you have other aspects also. Your social commitment, the charity work, your aspirations, clinical aspirations, the ethical practice, because of the clinical establishment bill and the code of ethics which has come into effect. So you have to adapt to that also. Giving large advertisement may be a problem. So you have to be very careful. So I think all the juniors, I think they have their own aspirations. Not all of them are thinking about the financial position. Of course, financial security is a must, but your clinical experience, your research attitude, all that can be developed only in an institute or a corporate hospital. I think for a while they can use that ladder and gain experience, then think of group practice. That's the best way. You have your independence, you have your financial security, you can do your clinical work, your research work, your social commitment. So I think the juniors can, some of you can get together of equal mind. I think that will be a good alternative.
Thanks a lot, Dr. Senthil. I got what I wanted from this session. If it was longer, it's a good crowd for a practice management session. If it was Saturday, it would have been even better. Great. Thanks, all of you. I request Dr. Sasikumar to give the certificate and memento first to Dr. Senthil. And Dr. Kaushik.